So now we welcome Anjali Marto, one of the UK's leading consultant dermatologists. Hi.
She is just, there we are.
Hello, hi.
Hang on.
You're
Can
mute.
you hear us?
That's it.
You can hear me now, right?
Yes, we can hear
Hi,
you.
how are you doing?
Oh, well. And I've got to say, I really enjoyed that previous chat as well. So much useful information in it.
Oh, fantastic. So Dr. Anjali has worked in the UK, in the UK public sector, and now practices on London's Harley Street, where you treat patients with a diverse range of skin conditions. And you're also the author of a best-selling book called The Skincare Bible, The No-Nonsense Guide to Great Skin. Thank you so much for joining us.
Oh, thank you for having me.
Thank
And
you.
I'm really pleased to be talking about skin and mental health. Like, coming from like a doctor point of view of treating skin disease, but also a patient point of view of having struggled with my skin my entire life. Like,
Really?
something I really feel quite strongly about.
Yeah.
I'm so excited to talk to you. Actually, so my first question, from a therapist point of view, can you explain how the mind, body and skin are connected? You know, how stress and our emotional life impacts our skin.
Yeah, so, I was thinking about this question, and the one thing that a lot of people don't realize is when you have a small developing embryo, if you look at where the skin or the epidermis, the top layer of the skin, develops from, and also where the central nervous system, so our brain, our spinal cord, develop from, is from the same place, the ectoderm. So there is a massive overlap between skin and mental health issues, partly because they come from the same place. The same cells split off whilst we're very, very, very small developing babies to form both of those things. And I think a lot of people don't recognize that because it's a bit of a niche random fact.
Yeah.
But the second thing is, I remember, probably in my first year of derm training, one of the first things that we were taught was somewhere between about half of our patients to about 75% of our patients that come into clinic with a skin problem are very, very likely to also have an underlying mental health issue as well, because they are so closely linked. So we were always told, be aware, think about it, it might exist. And from a practical point of view, I guess, in terms of answering your question, how are they linked? Well, you can either have a skin condition that can get worse with stress. So acne, eczema, psoriasis, rosacea are really good examples of this. You can have a skin or a hair condition that isn't harmful to your health, isn't dangerous, but it's so stigmatized that can create feelings of anxiety and depression. So things like alopecia, things like vitiligo. And then the third group is you can actually have mental health issues that actually manifest in the skin. So for example, if you're really anxious and you're really stressed, so you pick your skin or you scratch your skin.
Right.
When you go to the dermatologist, you will say, oh, well, look, I've got these sores on my skin. But when you backtrack what's going on, actually it's the anxiety that's driving the skin picking. So treating the skin itself isn't going to be the issue. You have to treat the mental health part. So I think there are three different aspects you could look at.
Yeah, that's
so
really
interesting.
What's the most common skin issue, would you say, when you see in stressed people?
So I actually think in terms of common skin conditions, acne, eczema, psoriasis are probably the big three. They are the big bread and butter of most dermatology. You know, most of the population will suffer with one of those or know somebody that does. And all of those can be triggered by stress. So, I think it'd be very surprising if anyone is untouched by a skin condition that is aggravated by stress.
Well, is it the cortisol that is where does it
so the sciencey bit is
go on, tell me the sciencey bit.
So if you think about you're stressed out, there are two different pathways. So the first pathway is you're stressed, and that causes a bit of your brain called the hypothalamus to produce a hormone called CRH, cortisol releasing hormone.
Okay.
That hormone has a knock-on effect on another bit of the brain very close by called the anterior pituitary,
Yes.
which release a second hormone called ACTH. The
Okay.
names are a bit irrelevant, but essentially what happens is that second bit of the brain then transports that second hormone through the bloodstream to your adrenal glands, and it makes your adrenal glands produce more glucocorticoids, so cortisol,
Yes.
and also catecholamines, so adrenaline and noradrenaline, your fight and flight. And all of those can cause inflammation. And then the second route is you're stressed out, and it activates part of your sympathetic nervous system, which again triggers your fight and flight response. But the combination of the brain bit going to the adrenals and the sympathetic nervous system, the end result is they funnel into basically modulating your immune system and driving inflammation. So inflammatory skin conditions like acne, eczema, psoriasis, rosacea will be triggered by it.
Wow, it's such a huge subject, isn't it?
It is.
Because you've got sort of a very holistic view, haven't you?
I do, and I think, to be honest, it comes from having had problems with my own skin. I think if you've never suffered with skin problems and you are genuinely so genetically blessed, and I'm jealous, by the way, but you don't know what it's like, it's very hard to describe how, when you look in the mirror, what you see is kind of a self-loathing almost of the fact that you don't want to look at yourself, or you feel slight repulsiveness or disgust. And I'm saying that from a personal point of view of having had my own skin problems. But even when that skin problem gets better, the crazy thing is that you still associate yourself as being that person that had that skin problem. And when someone pays you a compliment, you're like, really? Because when I'm looking in the mirror, I am still seeing that spotty 12-year-old. It's bizarre.
Yeah, it's so true. A friend of mine, actually, she always had acne as a younger person, and she's still getting treatment for these acne scars, which no one can see, because she still sees herself as that person who had acne when she was younger. And she will examine her skin in the most minute detail, because she still associates with that person, which I sort of think it's kind of an identity which she doesn't realize she's outgrown, you know?
And, I think, most people will develop acne, just because we're talking about it as an example, during adolescence. And adolescence is already a time when you are so stressed out about your body image and your self-appearance. And then acne comes along into that, sure, that may get better as you get older, but you're still like in your formative years, that's what you associate yourself with. So I'm not surprised to hear that. But the other thing is about 10% of people that have acne also suffer with a degree of body dysmorphia as well. So even if their skin gets better, they are still, the people, and I'm slightly guilty of this as well, that you're looking in the mirror and you're going, oh God, my skin really doesn't look very good today. And other people will say to you, you look fine. I literally do not know what you are talking about, but you're like, but I can see it. Can you not see that one mark that I've got over there? So it's very interesting stuff.
But that is when sort of someone will, I always sort of think of it like a picture. Often we'll focus on one tiny thing, but you'd never look at a portrait or a beautiful picture and just look at one tiny detail. You take in the whole picture to appreciate it. And I think that, human beings and the way, our appearance is all about that. We see, the whole thing, and we pick up on someone's personality and how we feel with them, all of that, the unconscious sort of behaviors.
Absolutely. But I think when you come from the background of that skin issue, like, there's study and data that shows that a condition like acne, for example, even if your acne is not that severe, it can still affect your mental health to the point that you may have a condition like diabetes or heart disease, because it doesn't have to be severe to cause that issue. Conditions like psoriasis, on the other hand, there's a lot of data that shows that the worse your skin disease is, the more likely you are to be depressed. But it's funny how with some skin conditions, you see that correlation of severity means more mental health issues, and certain skin issues, you're like, it doesn't even have to be that bad to cause a mental health issue. It is interesting.
So what do you recommend then for people who are stressed at the moment, particularly, and are having skin problems and issues?
So I think the first thing I would say is maintaining a routine. And I know how difficult that is when you're feeling miserable and low. The last thing that you want to do is think about cleansing your skin morning and evening and making sure that you're following either a skincare routine or a medical treatment plan. But I think routine is important.
Okay.
I think the second thing actually is thinking about how you can minimize your stress levels. And, you know, I'm very aware, for example, you know, teenage girls these days, what, a quarter of them will suffer with mental health problems because of body image issues, because of social media.
Yeah.
So if you are on social media, which I think a lot of us are, a lot more because we have more time on our hands, think about what you're following. You know, if you're looking at something and your feed is basically making you feel worse about yourself rather than better, you need to mute that, or you need to unfollow, and you need to find yourself some good skin positivity accounts. I think, you know, for me, I always say exercise, yoga, meditation, something that makes you feel a little bit more calm inside. And I recognize the privilege of this, but I think the other thing, and you know, for me, the biggest thing that I think helped me break my skin barriers was actually seeing a therapist. And a good clinical psychologist. I recognize what a privilege that is, but if you're in a position to do that, I think that, you know, we know that stress will make skin conditions worse. And then once your skin condition is worse, you're going to be more stressed out. And that cycle is going to repeat. And then even if you're in a good phase with your skin, what will happen is you live in constant fear of like, oh my God, I'm on borrowed time. Like, God knows how long it'll be good because it's only going to get bad again, that you can't even enjoy it when it's good. And I always feel like what a good therapist will do is make you feel in control of your skin rather than your skin is controlling you. And that's where we need people to be.
Yeah. It's kind of like, you know, if someone's, you know, coming to me for anxiety, it's like they can get control of that. You know, they are not their anxiety, what we were saying with Pat and Hannah, you know, the identity of it, you know, and be able to give them coping skills so they can manage.
Absolutely.
You know, to calm the feelings throughout the emotional brain, you know, and calm the nervous system down. I think it's so interesting because actually one of the questions, Lisa, wasn't it? You were going to ask was about psychodermatology as well.
Yes.
The benefit of that. Which I think is really interesting.
What is psychodermatology, first of all?
So psychoderm, I mean, it's combining, you know, psychiatry, dermatology, but essentially it deals with the two aspects of either you have a skin problem and it's being aggravated by stress, or you have a mental health issue that is manifesting as skin. So what psychoderm does is it covers both of those, but the approach is slightly different. So for example, if you have got a primary skin problem, acne, eczema, psoriasis, and it's being flared by stress, a therapist is the answer. You know, CBT can help, schema may help, any of those things. If you've got a primary psychiatric disorder that's manifesting the skin, there is no point me treating the skin alone, because actually what needs to be treated is the anxiety or the depression or the self-esteem issues. And that might need the input of a consultant psychiatrist. So I think psychoderm encompasses all of that to basically figure out, you know, which route do we go down, but to recognize we're not actually going to win with your skin condition unless we accept that the mental health is a massive part of it.
What's the sort of most common issues or where you've seen a bigger increase in certain skin conditions because of the way we often live our lives, where people are not in stress some of the time, they've accommodated a level of stress which is not helpful?
So I think acne is probably the big one, only because 80% of the population suffer with it at some point. 80%. And then if you look at women beyond the age of about 23, 24, over a quarter of women will suffer with adult acne as well. So, you know, purely because of numbers, purely because of how common it is, acne is definitely a big one that I would say. But I think social media separately is driving a second issue where people may not necessarily have bad skin, but what's happening is they're looking at all of these really heavily filtered photographs and beginning to think that's what normal skin looks like. You know, it's flawless, and you know, the lips have to be a certain size, and we're slightly losing that because that's not really what real life skin looks like.
What about hormonal skin? How do you see a lot of that where hormones are a big part of it?
Yeah, and you know, with a lot of skin conditions, and again, you know, acne being the big one, you will get predictable changes because of hormonal patterns. So that change could be either during your monthly cycle, where people will find that their acne tends to get worse in the week before their period, which is very, very common. And that's partly driven by the balance of hormones that's going on during that period. but also because a lot of women may suffer with PMS type symptoms. And if you're suffering with PMS type symptoms and you're stressed out, that stress may also be adding to that hormonal kind of balance mix that is going on. So it's chicken and egg, you know, is what's driving it, but both are surely contributing to it. But also hormonal changes during pregnancy, you know, acne is very common in the first trimester of pregnancy, very predictably, because you produce more of progesterone, which has got basically acne type effects. And then also as you approach the menopause. So I think particularly for females during a short period of time, but also during the course of your lifetime, there are very predictable changes that you can see with your skin as a result of hormonal changes that are going on as well.
Yeah.
What do you suggest for acne? What's the treatment?
Oh God. I mean, look, that's the $1 million question, right? I mean, I had my first treatment for acne when I was 12, and I'm now 40, and I'm still treating my acne. So, you know, it's a long journey. But what I normally say is, if you're struggling with spots, the first thing probably would be to try over-the-counter skincare. So skincare that contains ingredients like salicylic acid, glycolic acid, zinc, niacinamide, benzoyl peroxide, and retinols, and they can help. But if you've been doing that for a couple of weeks and you notice there's no real improvement with your skin, or your skin's getting worse, or it's affecting your mental health, and this is the big one, if it's stopping you from living your life, if it's stopping you from going out on dates, it's stopping you from like wanting to see your friends, it's stopping you from wanting to leave the house without makeup on, I think that is the point where you should actually maybe have a chat with your NHS GP, because they may be able to offer things like prescription cream, prescription tablets. And then if those don't work, I think the next step is to see a dermatologist and have a chat about what other things can be done. But, you know, my big worry with conditions like acne and skin problems is they're really trivialized as cosmetic issues. They're not, they're medical problems, and nobody should have to live with it. Nobody should have to feel like their mental health is suffering because their skin is causing them a problem.
And also, how does mental health sort of deplete nutrition in the body, and how's that affected on the, how's that shown up on the skin?
So generally, I mean, again, very general terms, because I've got so many different mental health issues. One of the things that can happen, for example, if your mood is low or you're not feeling good about yourself, it's very easy to get like drop off the motivation to either do your skincare, which is going to help, or take your medical treatment plan, be that creams or lotions, potions, tablets, whatever it might be. And the knock-on effect of that is you're clearly going to see a detriment to your skin. But the second thing is also, if you're low in mood, chances are you may not be looking after your diet as well. And, you know, one thing I would say is, whilst there are no superfoods or holy grail of if you eat X number of blueberries, your skin's going to get better, what I do think is your skin health is very closely tied to your general health. So anything that you eat that is good for your general health is going to be good for your skin. So if you suddenly fall into a trap where you're not eating your leafy greens, you're not getting enough zinc, selenium, magnesium, you're not getting enough vitamin C, vitamin A, vitamin B, all of these things which are key for skin health, the skin is not going to do well as a result of that. You know, you're going to deplete nutrients. So a lot of the effects are almost secondary effects because of the effects of the mental health concerns themselves.
Do you use supplements as a way of helping someone who's struggling with acne or a skin condition as well? Is that something you do as part of your program?
I generally don't, actually. The main reason being, I would say most people that follow a healthy diet, and I'm going to state quite clearly, you know, I have a selection bias of patients. My patients are probably women aged between 35 to 55. They are well educated, they're clued up on diet, they're clued up on nutrition, they're clued up on health. So the people that I see, they don't generally need something more because their diet is already good. But I do think that if you are long-term depleting your body of nutrients like vitamin A, vitamin B, vitamin C, you're depleting your body of minerals, you're depleting your body of, for example, iron. I mean, one of the things I'm actually seeing a lot of in clinic at the moment is a lot of people are going plant-based and vegan. And that's great. But they're not replacing their iron, their B12 and their folate, and their hair's falling out. And I'm seeing so many young people coming to me saying, my hair is thinning. And then when you talk to them about, well, is your diet inclusive? Do you eat everything? Do you drink everything? often what you will backtrack it to is actually, I'm either mainly plant-based or vegan. And that's not a criticism of either of those diets, but it's more a fact that if you are going to implement those diets, you do have to make sure in that situation you are appropriately replacing. Otherwise, you're going to start creating other issues that you didn't have, like hair loss.
And what about the skin? What would it do to the skin?
So long term, what you will find is your skin will become more fragile. It won't heal as easily. The other thing as well is generally the appearance of the skin. You know, if you're lacking key vitamins, key minerals, there will be sallowness to the skin that you see. So, you know, people want their skin to look bright and glowy. That's always the thing. People say, how can I make my skin look more glowy? And a lot of that does come from, you know, it's not just about skincare. It's about the whole thing. It is about that holistic approach. You know, it's exercise, it's diet, it's sleep. It's all of the above that feeds into each other.
And how about, can you just talk a little bit about rosacea as well, and how that sort of flares up during stressful times?
Yeah, so I mean, rosacea, again, it's an inflammatory skin condition. It's very common, tends to affect women more than men, tends to affect fair-skinned women, and predominantly affects the face. So you get redness. The underlying issue with rosacea is really, really reactive blood vessels underneath the skin. So somebody that's got rosacea, their blood vessels are getting bigger and smaller at the drop of a hat to all sorts of things in the environment, to all sorts of things that you're putting on the skin. And the problem with it doing that constantly all day, hundreds of times a day, is it's a bit like stretching an elastic band. If you keep stretching that elastic band over and over again, what's going to happen? That elastic band is going to become permanently stretched. So that blood vessel underneath the skin is going to become permanently stretched. Now that blood vessel is permanently stretched, there's more blood flow through it. If there's more blood flow through it, it's going to make the skin look red. So that is essentially part of the underlying issue, is really reactive blood vessels that are behaving in a certain way. And then because it is an inflammatory skin condition, that whole kind of cortisol pathway that we discussed and the sympathetic nervous system can drive into that. So it's very, very common to see emotional stress in general, chronic stress over a long period of time drive it.
And is eczema, do you see more eczema in younger people, or is that?
Yeah, so eczema is a skin condition that is, again, inflammatory, and it's more common in kids than adults. So about a quarter of children will suffer with eczema. So what I tend to say is about, 50% will grow out of it by the age of 5, 70% by the age of 7. And then by the time you get to adulthood, you're probably talking about 12% of the population. So whilst it's common, it's not as common as it is in childhood. And a lot of adults that have eczema, again, stress is one thing that if you say to someone, has anything really important or major or disruptive happened over the last 12 months? And guaranteed there will be a bereavement or a job change or a divorce or something that will explain it. That actually, unless you ask the question, you won't think about connecting the stress and the skin itself.
Yeah, go on, Lee, sorry. Go on.
Well, I was just going to ask about depression and how that affects the skin. So if you've got a really low mood.
Yeah. So I think a lot of the effects of depression are indirect effects. So it's not the depression that's directly acting on the skin, but depression itself will lead to behavioral issues. Right. And those behavioral changes that you have will then impact on the skin. So if you're low in mood, we know that it's much harder to get motivated to do a lot of daily activities. That is one of the almost defining factors of depression. So if you're then also going to then not take the same effort with maybe your skincare routine, your medical treatment plan, your nutrition, your sleep is affected, all of those multifactorial issues come together as part of the puzzle as to why your skin doesn't behave itself either. So, I've had a lot of patients over the past 6 weeks since lockdown has happened say to me, my skin is terrible right now. And I keep saying to them all, right now is not a normal period of time. Like, we're all stressed out. People are being furloughed. They're being made redundant. We don't know how things are going to pan out. There's the stress of like maybe catching an illness or knowing someone that's caught the illness. It's not surprising that actually your skin's not behaving itself right now.
So you kind of normalize it really in terms of that, of feeling that way. Because that prolonged sense of uncertainty can cause levels of increased anxiety with people.
Absolutely. And it's that chronic level of stress that we're talking about.
It's blaring. Yeah, totally. So would you say as a takeaway for someone, what your top 3 recommendations would be? Have a good cleansing ritual.
Yes, okay, so
What do you do at home as well?
Yeah.
I mean, from my point of view, like, you know, I am still pretty militant about my skincare routine. I definitely, like, that's something, if anything, I look at this time as I've got more time than usual now to look after my skin, so I'm going to do so. So definitely routine. But the second thing that I have to be honest, I'm absolutely militant about is I do not follow anything on social that I open up that makes me feel bad. And for me, it's women in crop tops with like their 6-packs out, and everyone's going to have a different trigger. But for me, I'm like, no, your abs make me feel really like inadequate right now. So I just don't look at that. Like, if I don't look at it, it's not there, and then I don't need to worry about it. So I think there's a real thing about culling social media feeds.
Yeah.
I also think that we also, as a generation, need to be encouraging our younger nephews, nieces, whatever it might be, to recognize that, you know what, like, social media isn't real, and people really don't look like that in real life. You know? But also, not only do they not look like that, but your self-esteem is so much more than what you look like. Like, you can have skin problems, but that doesn't stop you succeeding. It doesn't define who you are. And I think to be able to say to your 6-year-old niece, maybe, you know, I have bought you this thing, like, I don't know, even if it's a piece of exercise equipment, because I want you to be strong. It's not because I want you to be pretty. And I think that we can rephrase and we can retalk about how, particularly with young women, how we behave, how we phrase ourselves. Because, you know, let's face it, what we look like is luck of the draw, it's genetics. And it is not who we are. It does not define us. And I think that the third biggest thing is, if you have got the privilege to do so, then a good therapist or a good clinical psychologist, I could not, hands down, recommend that more.
I think it's so lovely the way you talk about, you know, it's who we are, not, you know, just, there's so much emphasis, especially with social media, the amount of content we're exposed to on a daily basis, you know, that is focused on, you put a selfie up and it gets thousands of bits of engagement, other than, you know, the stuff that people can't see, who we're being. Have we been kind today? Did you, you know, show appreciation for what you have got rather than what you haven't? You know, because how we change, how we look will change over time, right? You know, we can do, it's great to celebrate, which is what you're saying, celebrate who you are. And of course, the joy of, you know, your skin and your hair and makeup or whatever. But that's not it.
No, there is still more to life than just that, because it's luck of the draw, you know, what you end up like. And I think, you know, it's funny because, you know, as that spotty 12-year-old that developed awful skin at the time, and then for me, it was a number of factors. Like, my father died, I developed acne 2 weeks later, I moved countries, I moved schools. I was like, God, I was shy. Like, I remember girls at school saying, oh, she's really ugly. And like, having gotten older and my acne getting better, like, I still remember being in my 20s, and even to some degree now, someone says, oh, you look nice today. And I'm just like, I can't take the compliment, because I feel like I don't know what they're talking about. But I've certainly, like, you know, seen a therapist in the past from a skin point of view. And the biggest thing that I think I took away from that was, you know what, it doesn't define you. It doesn't define what you like, what you can achieve, what your successes are, how kind you are to somebody else. Like, that's all secondary stuff, what you look like.
And the amazing thing is because of that experience you've had in your past, the way you are able to treat people now is with such a great empathy and understanding, because you've been through that, you know, and be able to relay this message from the platform that you have, which is so important. You know, really wonderful. Thank you so much.
Amazing. Thank you so much. It was so interesting. Thank you.
Take care. Bye.
Thank you
wonderful.
so much.